Guest analyst today is Sunny Olukunle Phillips. He is a health specialist, and of course the topic again is impact of medication errors on patient outcomes. Doctor, it's a pleasure to have you join us this morning. Dr. Phillips, are you there?
Yeah. Good morning.
Good morning. Yeah, thank you for joining us. So I don't know if you watched the videos or the video we played before we began talking about this particular topic. But it was about a concerned parent whose child had been treated without the parent's consent. The nurse had given the child 7 injections because the child was looking pale. And then the injections had been given to the kid before a blood test was even done. And the parent is saying she's going to really ensure that the medical practitioner is brought to book. Have you had cases of this kind of thing, you know, in Nigeria? Is it common?
It's part of our health system. It's very common because several issues are playing out at the same time. Can you hear me?
Mm-hmm.
Yes, we can.
Yeah, so as a medical doctor, there are questions I want to ask. First and foremost, the facility, is it designated as a certified health facility? That is one. The personnel that attended to that kid, are they qualified personnel? And qualification and recertification of healthcare providers are usually guaranteed by, are oversighted by different regulatory bodies. So the level of quackery in the health system is also very high because of the dysfunctional state of things across the country. So this is the story is not unique. It's because she has the platform. There are similar stories taking place daily. Yeah, that's it. The farther you move from the cosmopolitan area, the worst case scenario plays out regarding quality of health service delivery. So it's part of our health system, sadly.
All right, thank you very much for that. Now, when cases like this happen, do the hospital, do they take any responsibility? Do they take any precautions measures? Maybe heads should roll or some disciplinary panel is being set up to make sure that this doesn't happen again? Because, I mean, if this is not done, it will continue to happen.
So the various regulatory bodies, they have mechanism for taking investigation at the first time, at the first case, and then meting out necessary retribution and punishment as they deem necessary, as they deem fit. So that is already on ground. There have been publicized cases of health practitioners that were found to have done things that are unethical or were involved in some fraudulent or incompetent practices that they have been sanctioned, and some their certification have even been withdrawn. Health facilities that have been found guilty for this kind of practices, some of them have been shut. So the regulatory system typically will respond if they are officially informed, and they normally would respond, and they've responded in time past.
All right. Now, if you remember the late singer Mohbad, who died not too long ago, it was due to activities of a quack. Now, you also mentioned in your submission earlier on that quackery is a serious matter when it comes to the health sector in Nigeria. Now, how do you? But then you've had doctors who are certified, who are professionals, who've had cases of errors as well. Now, so this is my question. How do you think technology, such as electronic health records and automated dispensing systems, can reduce errors in medical practice?
Okay, yeah, several layers of value that tech can bring in when it comes to prevention of medical error. So we've had cases where, so you have like 3 layers of activities: the prescription side, the dispensing, and then the administration. So every of those layers can have, we can have issues playing out that can result in medical error and in some cases very fatal uh, outcome. So there have been situations, and I've been in the clinic where a doctor writes something and it's not very legible. And occasionally we've had pharmacists who will say, "Sir, can you make this clearer so that we really know what you are prescribing?" So if you have an electronic mechanism where you don't even need to write, you just call out a particular drug that is already typed into the system, and that is what the drug you meant, then you know that kind of illegibility is already taken care of. And then also, where, now that came out some time ago with barcoding, where you can actually track a medication from the qualified producers, certified pharmaceutical companies, and then track it to the point where the patient takes that medication. And the patient too can verify whether that medication is fake or authentic. So you can use technology in such cases. We also use technology to record and quickly report adverse reaction to drugs so that prompt actions can be taken. So those are some of the points, around technology prevention of medical errors.
All right, so we've talked about even medical professionals, certified medical professionals making errors. Then we also have the unqualified or the quacks. So let's focus on the unqualified and the quacks. I know even to study medicine requires a whole lot. I mean, hurdles, it's very tedious, even nursing. So how can we sieve out, or isn't there some sort of mechanism or something put in place to sieve out these quacks? Or how do they even manage to get into these medical facilities and have access to patients?
So thank you. Quackery, of course, at different portion of the value chain. You see, get to any of the street junctions, you will hear someone, permit me to use local language now, selling stuff for staphylococcus. You hear that. Recently, traveling along Lagos-Ibadan Express Road, I still heard someone beaming speakers, and it really got me thinking that we are all listening to this charlatan, deceiving people, swindling them of their hard-earned money, selling nothing but fake items to them, which have very serious consequences actually. So at the consumer hand, it occurs. Outside the facility, outside the health facility, there's a whole lot occurring. Even drug production. We recently saw NAFDAC busting some fake companies producing drugs. So there are a whole lot of medical quackery taking place outside the health facilities. So in healthcare service, there are health facilities, there are also health facilities. There are certified health facilities, and there are all certified that you cannot even refer to them as health facilities. Somebody will tell you, I'm a doctor because I'm a herbalist. That's to the uneducated populace. It's also a health center. Someone retires from work and says, "Oh, I want to start selling drugs here." It's taken as a health center. So by law, only certified facility for delivering healthcare are recognized by law. But there are several spaces where people put on white gown and begin to dispense drug, or do even far more than dispense drug, doing terrible things. So it has to do with oversight, it has to do with regulation, but do you have the resources to to oversight a very widespread community as ours, where people cannot even afford the regulated system and we rather make do with what they are able to get by the roadside.
All right. Secondly, you mentioned something about certified medical center. So how can someone like me, for instance, in my area, there's a medical facility or a health center, how can I even be able to know whether this particular medical center or health center is certified or approved? I could just walk in because I see people wear white and all that. You know, for a layman who probably is cash-strapped, he could just want to walk into that health center and not knowing that that particular health center is not even certified. So how can one know? Is there any signboard or anything that you can request for to know that, okay, this particular health center is certified?
Thank you very much. That's a very important question. So this is where the issue of demand and supply comes in. The populace that is consuming this needs to be an educated populace for them to also be part of the measures to mitigate medical error. So if it's an educated populace, when you enter into a healthcare facility, there must be the annual practicing certificate displayed. Typically, should be displayed, but people care less. They are not even looking out for it. Talk less of wanting to cite whether it is the current or it's 10-year-old. So you take the responsibility as a healthcare service seeker or purchaser to say, can I cite if this is a legit facility? Ideally, they should display their annual practicing certificate. Photocopy of it should be displayed in full glare for everyone entering to see and cite.
Very well said. So, Doctor, you've talked about an educated populace. You also talked about how technology can help reduce errors, especially when it comes to legibility, talking about prescription and all of that. Now, I don't know if you remember, not too long ago, you were on our sister channel, our sister station, High Impact 102.1 FM, and we talked about doctors being overworked and being stressed. Do you remember that discussion we had not too long ago?
Yeah, clearly, yes.
So do you think a doctor who is overworked, who is stressed, who has lost focus, who is not well paid, who is not even happy with the job he or she is doing, do you think instances like this could lead to error?
Thank you very much. In the best of the best health systems across the globe, there is a proportion of medical error taking place. In the best of the best, there is hardly any country in the world, any country health system in the world that is free of some measure of medical error. Hardly, even with the best of intentions. Not to talk of a situation where a doctor is positioned in a place to be thinking of the school fees of his children that is yet to be able to afford, or talk of how he's grappling with increased fuel price. He's yet to fuel his vehicle. He has to be on the queue at a petrol station for 2-3 hours, and it's being beeped that there are emergency waiting. So that even spikes the potential for medical errors. No thanks to, not for his incompetency, but because the system is not supporting the reduction of medical error by the kind of pressure and stress it puts not just the medical doctor, even every team member on board. It puts them in terrible stress that they are not even free in their mind to be fully committed and concentrated on the job at hand. So that even gives room for greater occurrence of medical errors.
All right, thank you very much. Now, so let's look at how the federal government or state government can step into this. On Wednesday, 18th of September, we celebrated the World Health Day, and the Guardian newspaper still talked about this medical error, that Nigeria is still lacking behind in medical errors. So
you're talking about Patient Safety Day.
Safety Day, I beg your pardon. So, and the Guardian actually still talked about this particular topic, that Nigeria is still lacking in medical errors. So how do you think the federal government can step in? Because this is something that it's the ward or the parent or whoever that is, the families of the so-called deceased, that bear the brunt of this whole tragedy.
Okay, thanks. Let's look at both demand and supply, like I said earlier. The populace that is procuring air service has to be an educated populace. So the general education is key. So let me tell you, I'll give you an example. Most of these quacks, do you know what they do? They will go into the hinterland, where they know that people cannot decipher what they are selling to them. They actually ride on the ignorance of the people to push fake drugs to them. So that tells you that if the people are educated, I'm even talking of basic education, they stand a better chance. And then if you then layer on that health education in languages people can recognize, that's even an improvement. That's the supply side. That's the demand side of the populace. The supply side, production. What NAFDAC is doing, the great work NAFDAC is doing, has to be strengthened. Can they monitor all the points across the country where that are notorious for producing fake drugs? Can they monitor supply chains of authenticated drugs so that the supply chain is not broken for people to feed in their fake drugs into the normal health system? That is done also. You will find people who are pushing fake drugs. They hang around health system ops. They know a teaching hospital is somewhere, they will hang around that so that they can also channel their fakes into that supply chain. That also requires a whole lot of regulation. Law enforcement is key. You rarely get to see some of people selling fake drugs. Sorry, I'm laughing.
No, it's fine.
I've been in a major general hospital, and I took a picture of an agbo seller right in the general hospital.
General hospital.
I'm telling you, I took a picture. Right in the general hospital, spelling herbal drugs. Of course, we are not saying herbal drugs are essentially fake. We are just saying, how will you even allow something that is not regulated to be displayed within a general hospital? So regulation, enforcement, inspection. So if you have every ministry has a department devoted to this, but is that department resourced to be able to go on inspection, to be able to go and verify whether a health facility has renewed its license? So all these are what the government has to put in place to ensure that we minimize medical errors. Like I said earlier, we don't have cases where you have completely, totally eliminated medical error, but it can be massively minimized.
Thank you very much, Dr. Phillips. You have been very brilliant, and I'm sure all our listeners, viewers have learned one or two things from your thoughts this morning. We do appreciate that.
Thank you. Pleasure being here. All the best.
You're welcome.